Every day, we take over 20,000 breaths. It's an unconscious rhythm, the very essence of life. But what if this fundamental act is slowly harming us? Across our cities, an invisible danger lurks in the air, a complex cocktail of pollutants that has transformed our atmosphere into one of the greatest silent threats to public health. This isn't a distant problem. It's a daily reality. Nowhere is this crisis more acute than in India, home to many of the world's most polluted urban centers. The headlines warn of PM 2.5, but for millions, this means a tangible rise in respiratory ailments. To navigate this hazardous environment, we have a tool, the Air Quality Index, or AQI. It's that number on news apps and billboards, a simple metric designed to translate complex data into a clear warning. But is the warning being heard? How well do we, the citizens, actually understand what these numbers and colors mean for our families? This film delves into the findings of a nationwide survey, exploring this critical gap in public awareness. We'll uncover why understanding the AQI is the first crucial step towards protecting every breath we take. The Air Quality Index, or AQI, is a powerful tool that tells us how clean or polluted our air is and what health effects we might experience. It simplifies complex data on 8 major pollutants, including harmful particulate matter like PM 2.5 and gases like carbon monoxide, into a single, easy-to-understand number. This number is presented on a scale from 0 to 500, divided into 6 color-coded categories. An AQI of 0 to 50 is good, posing little risk. But as the number climbs into moderate, poor, and very poor, the air becomes progressively more harmful. Anything above 300 is classified as hazardous, a level where even healthy individuals can experience serious health effects. In India, this vital information is provided by the Central Pollution Control Board. Data is collected 24/7 from a network of monitoring stations across the country and made accessible through apps like Samir and official websites. With this technology, we have the power to know the quality of the air we breathe in real time. But the crucial question is, are we using it? Is checking the AQI becoming as routine as checking the weather before stepping outside? The gap between data availability and daily habits is a challenge we must address. To understand awareness, we conducted a survey among 1,000 citizens across Delhi, Mumbai, Lucknow, Bengaluru, and smaller towns. The participants included students, working professionals, homemakers, and senior citizens. Their answers reveal striking insights into how Indians view the air quality around them. Here's what we found. Nearly 60% of respondents admitted they were not aware of what AQI actually meant. About 40% said they had heard of AQI, but only half of them knew how to interpret the numbers. This means that only 1 in 5 citizens can actually read and understand AQI values. Young citizens, especially those between 18 and 25 years, showed the highest awareness, at around 65%. Awareness dropped significantly among the 41-60 age group and was the lowest among senior citizens. This suggests that younger Indians, thanks to technology and education, are more aware, but our elders remain vulnerable and uninformed. Now, let's compare awareness with actual AQI levels in Indian cities. Delhi consistently records AQI levels above 300 in winter, categorized as hazardous. Lucknow often crosses 320, while Mumbai and Bengaluru average between 180 and 200, still unhealthy. This gap between awareness and reality shows why people often underestimate the risks of daily exposure. Poor air quality doesn't just make the sky look hazy, it enters our lungs and bloodstream. Our survey found that over 30% of respondents linked breathing issues to poor air. Doctors confirm rising respiratory illnesses, cardiac cases, and even strokes correlate with high AQI levels. Children and the elderly are most at risk. But how many people actually check AQI before stepping out? Only 25% said they check AQI through apps or news updates. Among them, most were young professionals living in cities. In rural areas, awareness was nearly negligible. This shows an urgent need to spread knowledge beyond urban centers. So, what can we do? The first step is to stay informed. Make it a daily habit to check the air quality index on apps like Safa. This isn't just a number, it's a tool to make smarter decisions, like rescheduling outdoor activities on high pollution days. Second, education is key. Governments and schools must integrate AQI awareness into the curriculum and public campaigns. This builds a foundation of understanding, explaining the link between pollution, the AQI reading, and our health, fostering a sense of collective responsibility. Third, our lifestyle choices matter. Simple changes like carpooling, using public transport, and planting more trees create a significant positive impact. These collective actions directly reduce pollution at the community level, proving that small steps can lead to cleaner air for everyone. And finally, we must protect ourselves when the air is hazardous. Follow official smog alerts, limiting outdoor time for children and the elderly. Using certified N95 masks and indoor air purifiers are crucial defensive measures to safeguard your family's health. A clean breath is a basic right, not a privilege. Awareness is the first step toward meaningful action. Let's pledge to check the AQI daily, share knowledge with our communities, and make conscious choices to protect our air. Together, we can turn awareness into lasting change for a healthier India.